Hi guys, in this audio of GIT medicine, I will talk about gastrointestinal bleeding. Gastrointestinal bleeding is divided into upper and lower gastrointestinal bleeding. The upper occurs above ligament of tratus and the lower occurs below ligament of tratus. Now first talking about upper gastrointestinal bleeding, which is also the most common gastrointestinal emergency. Now moving on to the symptoms of your upper gastrointestinal bleeding, the symptoms include hematemesis and melena. So what is hematemesis? It basically refers to blood in vomitus, and it will tell us, and its color will tell us about the severity of the condition. If the condition is very severe, the color of the vomitus will be red, and if the condition is less severe, the color of the vomitus will be black. Talking about melena, it actually refers to your black tarry stools, and it is mostly due to your digestive blood. Now, moving on to the causes of your upper gastrointestinal bleeding, you can remember it by the mnemonic POG meme. As you know, the POG meme is very popular in the Twitch community, in the Twitch chats. You can remember it to remember the causes of your uh, upper gastrointestinal bleeding. Now, the P of the POG stands for your peptic ulcer disease, and it is also the most common cause of your upper gastrointestinal bleeding. G of the POC stand for your gastric erosions, and the gastric erosion can be due to your NSAIDs and alcohol. The M of the meme stand for your Mallory West tear, and the other M stands for your malformations, specifically vascular malformations. And talking about the E's of your meme, E stand for your esophagitis, and the other E stand for your esophageal varices. The vascular malformation that causes your upper gastrointestinal bleeding are your aortoenteric fistula and diaphyseal lesion. Now, moving on to the treatment of your upper GIT bleeding, first of all, you will assess the severity of the patient. You will measure the blood pressure, pulse, urine output, and central venous pressure. You will also note the CBC, urea electrolytes, LFTs, and why you are doing this CBC and urea electrolytes is because that you will assess the anemia and any evidence of your renal failure. Now, regarding assessing severity of the patient, if the patient is suffering from tachycardia, it suggests that the 10% of the volume is lost, and if there is orthostatic hypotension, it suggests there is 20% loss of the blood, and if there is shock, it suggests that more than 30% of the blood is lost. To resuscitate the volume loss, you will first give normal saline or lingual lactate. If you think there is a need of transfusion, you will assess it by hemocreate, not the hemoglobin. If hemocreate is around 20-25, you will transfuse, and if in young patient, if the patient is older, you will transfuse below 30 hemocreate. You will only transfuse platelets if the platelet count is below 50,000 and there is active bleeding. You will give PPIs for your bleeding peptic ulcer and uh, octreotide or telepressin if there is variceal bleeding. After resuscitation, you will do endoscopy. In case if endoscopy fails to control the active bleeding, you will do surgery. Now moving on to the lower GI bleeding, it refers to the passing of the dark blood and clots without shock. In symptoms, you will find hematochezia, which refers to your bloody stools. Now, talking about the causes of your lower GI bleeding, you can remember it by the mnemonic, that is your damn boy call for answer. The dam, which is the place we use to collect water, boy call for answer. So the D of the dam is your diverticular disease. And like the POC meme, the first word is the most common cause of your upper GI. Here, D is the most common cause of your D lower GI bleeding, and the D stands for your diverticular disease. A is your angiodysplasia. M is your Meckel's diverticulum. B is your bowel ischemia. Now, That's it for the damn boy. Now moving on forward to the call for answer. C stands for your carcinoma, and F stands for your fissure, and A stands for your any anal disease such as fissure or hemorrhoids. Now, the moving forward to the treatment of your lower GI bleeding, uh, what I told in the upper GI bleeding, it is really similar, except if there is treatment of a specific cause, like diverticular disease. If there is diverticular disease, the disease segment of the colon will be surgically resected. If there is angiodysplasia, the treatment of the choice is your endoscopic thermal ablation, and if the bleeding still continues, the the last option is your surgical resection. Now, if there is bowel ischemia, you will only do resection if there is also peritonitis. Now, that is it for this audio of your GI bleeding. Any suggestion will be appreciated. Anything you want to add that people need to know, you can comment down below. You can like, subscribe if you want. Thanks for watching.